The Medicare Annual Enrollment Period is officially open, and millions of Americans need to make critical decisions about their health insurance coverage. And joining us now to discuss this from Aetna Medicare is Vice President and Chief Medical Officer, Dr. Ali Khan. So, Dr. Khan, with this Medicare Annual Enrollment Period officially open now, what do our viewers need to be thinking about before they choose a plan?
Well, Pete, such a pleasure to be here because this is such a critical question, right? And during the annual enrollment period, which runs from October 15th through December 7th, there's so much information flowing around in all sorts of different places. People have real questions and it can get confusing. So I try to start with the basics. When you're thinking about a plan, number one, what is the plan that you can afford? What's in your budget? Number two, think about your trusted and favorite doctors, pharmacists, and pharmacies, hospitals. Are those in network with the plan? Are they covered? And third, what about the prescription drugs that you're taking? How much do they cost and are they covered by the plan? And that's something that can change from year to year, especially that cost level, Pete. So making sure you have up-to-date information, really critical. There's a lot of other information out there, a lot of the variables we can consider, but those are the three building blocks I really recommend to make really good decisions during this AEP.
Do you have any advice to help Medicare consumers understand their Medicare plan options?
Again, a place where I try to keep it simple. On one side, we've got traditional Medicare. We all know it, right? We know what it does. Where Medicare Advantage differs is in three really important ways that I think are advantages. No pun intended. First, affordability. In every Medicare Advantage plan, you will know before you sign up for it, the maximum out-of-pocket level that you will be responsible for paying for anything that you incur from a healthcare cost perspective over that year, right? So you can predict with ease how much is going to come out of your wallet for that year. Traditional Medicare, you just can't make that same kind of prediction, particularly when you don't know how much care you're going to actually need. Second, for Medicare Advantage, built-in prescription drug coverage with a lot of drugs at no cost or low cost to you and to our members to make sure that we're investing in wellness and health. Traditional Medicare doesn't offer that same type of coverage. And third, and this is where I get really excited, Pete, is in our investments in wellness and overall health. Vision benefits, hearing benefits, dental benefits, fitness benefits, and other things that members can explore on their own, match to what they feel is right for them, and which is a bucket of supports that we just don't see in traditional Medicare. So those are the three big things that I tend to think about in terms of differentiating between the two.
And Dr. Khan, what can people do to promote healthy aging?
One of my favorite questions, it comes up a lot in my primary care practice here on the west side of Chicago, where I see mostly seniors. First and foremost, focus on prevention. And yes, colonoscopies and mammograms are critically important. But honestly, let's take it back to basics. One of the best things we can do to keep our brains healthy and to prevent the onset of dementia, which many of us are worried about, is really focusing on annual hearing exams and annual eye exams. Those are the kinds of things that can help us catch things in declines in real time before they start to impact our memory and how we interact with the world. Second, move. 30 minutes a day of activity. Whether I'm imagining Pete's a power lifter on 7 days a week versus folks who are in a walking club or in a Tai Chi program or playing pickleball, any of those options are going to do wonders at improving bone health and your bone density, at improving your balance and therefore reducing the risk of you falling and having a really bad fracture, and in improving your cardiovascular endurance and your heart health, right? All of those things that we need to thrive for years and decades to come. And then finally, invest in community. Many of us are lucky to have outlets like membership clubs or faith-based organizations or book clubs or whatever in which to connect with community, avoid social isolation, and combat loneliness. But not everybody's so lucky. And so at Aetna, for folks who aren't that lucky, we make sure we can connect them to trusted community resources, to connect into places where they can build that kind of community and get the social vibrancy that makes life worth living. Those are my big three.
Covered a lot of great things here, Dr. Khan. Where can our viewers go if they'd like more information?
Well, Pete, just come visit us at aetnamedicare.com. That's aetnamedicare.com. Lots of places for your questions to be answered. We can connect you to real live folks to answer things in real time, and you can explore all your options and hopefully decide that an Aetna plan would be right for you.
All right, Dr. Khan, thanks again for being with us today.
Pete, thanks so much for having me.